in the summer you can do, I've done 40, 50 days on the trot before without a day off.
Really looking forward to seeing the work that the Seafit team are doing, providing healthcare to this coastal community.
Welcome. I'm Carol, the Seafit Programme Manager.
I'm Bola.
Welcome to Cromer, and we'd like to show you what we've been doing with the Seafit Programme, working and supporting fishermen. Today we have the Eastern Liver Trust network here, and the Dentate van providing free dental checks along with free Hep C tests. And we also have Fishwell, who are our mental health counsellors, who will be able to provide mental health support to the fishermen.
And I'm really interested to just hear from you, both in terms of the fishing community, but also as a coastal community, you know, your experience of access to healthcare.
Dentists is a big problem for a lot of fishermen, I know, because I do the training for all the fishermen from Lincolnshire down to Essex, so I speak to a lot of the fishermen. A lot of them say, getting a dentist appointment is one of the biggest problems.
Sometimes if you've got to get out there, you've got to get out there. How does that work?
It is difficult, you know. I mean, if your weather's been bad and you haven't been for a few days and your appointment's on the day you've got to go to sea, you've got to juggle whether you're going to go to sea or go and have things like that.
Right, so this is tactile fiberglass. Mine is 19 foot. They are either 19, 20 or 21 foot. So I work as single-handed. We are exposed. My ideal day is coming down first thing in the morning just before daybreak, and it's nice and fine and the sea is flat, and I know I'm going to shove off and I'll see a beautiful sunrise and we'll get the work done and be home within about 4.5 hours. Other days it's cold, it's wet, it's windy, it's really uncomfortable.
What's the health service side of it like for you as a group of people and for the community?
Well clinic down here about 10 years ago. My dad, he's 80 now, and that might have been 15 years ago, my dad was still fishing then, and he's probably been to the doctors 10 times in his whole life. And we just said, oh, come on, come down. So he come down and they'd done diabetes tests and everything, and they picked up on 2 or 3 things with him, what he would never have picked up on himself, because he's just like old school.
It's a bit of a mental strain, not just a physical strain. That's the problem we have, you know. So a lot of people this last 3 years have just decided, you know, coming up to retirement age is to sell up and, you know, do something else, or go part-time, or, you know, just move on.
Most fishermen wouldn't ever think of themselves being other than healthy unless they were literally falling over. You wouldn't be tested for anything not routinely. Well, I wouldn't anyway.
Now then, John, you alright?
Yeah.
You've got your results come back, negative for hepatitis C antibodies, so that means you're not coming in contact with hepatitis C. So, good news. Again, did I give you a book before to take away?
Yeah.
Good stuff, yeah. So have a read of that. Anybody else wants to be texted, I'm more than happy to text them. And again, the transmission routes are in that book, and they're the main ones.
Yeah.
Okay,
right. Thank you.
Nice.
Brilliant. Cheers, mate.
Cheers.
Thank you.
Bye-bye.
Pleased. Didn't expect it to be anything other than that though, but happy to know. I wouldn't have had a hepatitis test ever. It wouldn't even enter my mind to have that done.
We knew the guys were going to be a hard market to try and crack, but the uptake has been really encouraging. Nothing concrete.
Nothing
just
concrete.
Yeah. And is that okay?
Sometimes it's hard, but then again, like I said, you get a couple of good jobs, and you can soon crack some money behind you, so you aren't too bad.
It's all about trying to promote, I guess, the fisherman's mental well-being, be it, you know, anxiety or depression or anything really. Even if it's money issues that they've got going on. Just talk to them. Sometimes just being able to process all of that with somebody that's not making
take some of the pressure off.
Hopefully this year should be better than that. Hopefully there'll be more crabs and everything, so it should be hopefully a good year, but time will tell.
Do you think you'll go back crabbing?
I may do a few trips. I've done the food last year, but if I get offered the other work, I'll take it. Because nowadays, it's like you said, you got to go where you can.
It's just like another voice really to be able to
think it through.
Yeah, absolutely. Well, I've had no difficulties up till now, so we'll see
You're
what
not
it's
having any pain from your mouth at all?
They are just temperature changes and things like that, but apart from that, and as you'll see, my teeth are not good.
Okay. We've seen a lot on this van, so don't worry.
Yeah.
So Paul, you've got lots of broken teeth. They aren't necessarily decayed. I think that it's dentistry you probably had done 20 plus years ago that has now begun to fail.
Yeah.
Because dentistry has a lifespan. So let me just count, how many should we repair today? That's the next question. So we've got one here, we'll do that one.
One of the guys from just down the coast, he turned up and he went in and had his blood pressure checked, and it was literally off the reading. And so, in fact, the clinician came out and said, "Tim, can I just check your blood pressure?" I said, "Yeah, sure." I said, "Why?" He said, "I just want to check the machine's working." I said, "Yeah, it's fine." And his blood pressure was literally off the scale. Literally, it just wouldn't read it. It was so high. And he turned around and he said, "Oh, thank goodness for that." I said, "Well, what do you mean?" He said, "Well, if it's just blood pressure," he said, "I was convinced I had a brain tumour, and that's why I got double vision and why I was feeling dizzy all the time." And it was so bad they wanted to call an ambulance because they said he was ready to pop at any time, but he refused that. But he did go to his doctor and he did get some treatment.
When we talk about health inequalities, this is real. This is real for communities like this, whose lives and livelihood often depend on what the weather is doing at a given point in time. And therefore the fixed models of healthcare don't necessarily fit what this community needs. And to be able to see what Seafit are doing in terms of dental care, access to mental health support, the work that the health advisory colleagues are doing in terms of general health and well-being checks for this community. It's so invaluable.
Just hope more people realise it's available and get more people on board. Definitely come down. It's not a problem. It's 5 minutes out of your life and it could potentially save your life.